Welcome back to Great Day Houston, our medical show. Millions of diabetics take medication hoping that'll solve the problem. Well, oftentimes it does not. Joining us now is Dr. Stanley Lewis, the medical director of Diabetes Relief, and Dewan Davis. He was treated for diabetes, and you all have a treatment that you add to the curriculum or to the program, if you will, for somebody who's dealing with diabetes. And oftentimes, this is the thing that's gotten a lot of people's attention, damage caused by diabetes can be reversed.
Yes. And we're really two parts traditional medicine. We still emphasize diet, exercise. These are still very important. They're mainstays of treatment. But our treatment actually tries to address the root cause of diabetes.
Right. Which is what? Because I think a lot of people are confused that the root cause is actually the thing that causes so many other problems in people's bodies.
Well, actually, the root cause is inflammation. Inflammation that starts primarily in the gut, the pancreas, impairs the pancreatic pulse. The pancreas is responsible for sending a signal over to the liver, and that liver is then responsible for producing enzymes that are useful in our metabolism. Yeah. If that signal doesn't come over, then our liver is very inefficient at producing that energy, and we don't do well.
What causes the breakdown in communication between the pancreas and liver?
The initial insult is that inflammation. We believe that because the beta cells, which are responsible for producing the insulin, if they are not in coordination, they don't produce an insulin pulse, then you don't get the efficient metabolism.
And the reason why I ask that question is oftentimes we'll hear if you're overweight, it's going to happen. If there's a couple of other things you do, smoking, all type of stuff, it may happen.
Certainly overweight can be a big contributor because that can actually start the cascade of inflammation breaking down the pulse generation. And
when we say diabetes, I can't tell you how many people have said to me, well, it just runs in my family, right? And so it's not as easy as that. There are some things we can do to try and keep it at bay. But the other thing they don't understand is diabetes has a wide-reaching impact on our overall health. The number one reason for heart disease, renal failure, blindness, all types of things in the body.
And that's really what I like about what we do at Diabetes Relief. We don't just manage the symptom of a high sugar. We really try to address those underlying problems, retinopathy, neuropathy, nephropathy. Preventing people from getting these amputations or going on dialysis is really, really important, and our therapy seems to make a big difference with those complications.
Yeah. All right, there's type 1 diabetes we hear about. We used to call it juvenile, and then type 2 we used to call adult onset. We don't really do that anymore, but there's still two different types.
Basically two different types of diabetes, and as I've said on the show before, diabetes is really just one of the symptoms for metabolic disorder. Yeah. Type 1 diabetes mostly caused by an autoimmune problem where the patients don't actually produce very much insulin at all. Yeah. And then type 2 diabetes where the body doesn't produce enough insulin or doesn't provide the proper signal to the liver so that you develop the symptom of hyperglycemia.
All right, Dewan, it's said that most people walking around with diabetes don't really know it until something critical happens. How did you find out?
Oh man, that critical moment happened to me when I was at work. I manage restaurants for a living. I'm at work and it's like I couldn't even lift my arms. And I've been wearing glasses for a long time now. My vision, I couldn't see through my glasses nor without them. And I was at work, I was getting weak. I felt like I was gonna pass out. I had to leave, I was rushed, had to go to the emergency room. My sugar levels was above 600. I almost went into a diabetic coma.
Wow.
And
Did you understand what diabetes was at that time?
I didn't. I was not aware at the time. So I had to knock down and get on some research and see what was going on here. And it was so scary, because I have a 7-year-old son, and that feeling right there, I couldn't even lift him up. Yeah. And it was just very nerve-wracking. So.
All right, so you get a prescription for some medication and told to eat better and exercise. That should take care of it, right?
Yes,
but it didn't.
No, ma'am. I was prescribed for metformin, and even though I was taking that on a regular basis, I started swimming, doing more exercises, and I was still just not feeling right. The energy level still wasn't going up. It was like I was nervous. I was like, I'm not sure what it is I need to be doing. So I got up one morning and I said, I have to take control. I have to find something that's going to specialize in what's my issues and what's my problems with this diabetes.
All right, so Stanley, let's talk about what Diabetes Relief is and how it makes the difference.
Right, so Diabetes Relief centers around our intravenous insulin therapy. So patients are brought into our clinic, we do a thorough evaluation, We determine what their degree of insulin resistance is or their degree of insulin sensitivity, and then we create an individualized plan to help them get back on track.
Yeah. All right, and that individualized plan has been amazing. It's almost like boutique medicine, if you will, because you don't treat everybody with just like kind of one mass thing. You look at what exactly is happening in their body, and then you can treat that. Okay, so what difference did you notice right away?
Oh man, after the first week, I was having neurology pains in my toes when I would wake up in the morning, also before I would go to sleep at night. After the first week, that pain was already drifting away. The second week, that's when I started noticing like my vision getting better. I was like, hold on, I was
Take the door and find some old glasses.
Yes,
huh?
ma'am. Yes, ma'am. So I say my vision's getting better. That third week, I was able to see without my glasses. Like I can take my glasses off now and I can read far and near. And I had to get a new prescription because with my old prescription, I was unable to see with my glasses. And I was like, oh my gosh, what's going on? So when I went back to my treatment, I asked them, they say, yeah, well, your sugars are getting better. You had a lot of sugar in your bloodstream that was affecting your vision. And I wasn't aware of that.
Yeah.
I was nervous. I called my mom. I was like, Mama, I can see without my glasses. I don't know what's going on. She was like, well, baby, talk to him and find out. And that was something that, initially just told me, hey, something's going right.
And Stanley, so this is a great story, but you have lots of great stories.
Yeah, Dewan is special, but this is not uncommon, what happened to him in this situation. We start to see this a lot in our clinic. And what we tell our patient is, the pulse matters. Being able to have that insulin pulse restored allows you to get more energy, allows you to metabolize and regenerate your cells much better.
So it's eyesight, the neuropathy, you've had people who are scheduled for amputations who actually, after the treatment, they're like, okay, wait a minute, those sores, those wounds are healing now.
Finally healing. And nerves, more than any other tissue in the body, require carbohydrates for metabolism. If you want your nerves to grow and regenerate, you're going to need to be able to metabolize carbohydrates, and our therapy helps folks do that.
And a lot of folks have actually gotten off of the medication because they don't need it anymore, but you work with them to figure that out with their doctors and stuff,
Right.
But they don't need it anymore because the situation, the ship's been righted, if you will.
Over half of our patients are able to reduce their medications or eliminate some of them after just a few months on our treatment.
All right. Well, Dr. Lewis, thank you very much. Congratulations to you. Kiss that little baby boy for us.
Yes,
all right. Diabetes Relief has a special offer. You get a free bottle of Metabolism Enhancer, which is what you have right now. Tell us what that Metabolism Enhancer does.
Well, as you start on our treatments, you'll have much better metabolism, and that way you'll actually burn more of the micronutrients necessary to generate more energy and generate more you. So if your diet doesn't have those nutrients, we want to make sure you get a supplement that assures that you'll get the maximum potential from our treatments.
Now you get a free bottle of that Metabolism Enhancer with a consultation in October. So you have to have that consultation, but you must mention Great Day Houston as well. So don't forget, mention Great Day Houston in October. The number to call is 281-600-5000, 281-600-5000. You can also log on to diabetesrelief.com, diabetesrelief.com for more information or how to make that appointment. Thank you very much.
Thanks, Deborah.